I'm Dr. George Cosmides at drcosmides.com, home of healthy aging, founder and developer of the Life Without Diabetes program. I'm here today to talk about the concern about medications and the damage that they can potentially cause. And I want to preface this with, I'm not against any treatment or any medication. That's just not my thing. What I am into is informing you about the information and things that you can do for your diabetes. The problem with drugs for diabetes is this: it doesn't resolve the problem. Your kidney, liver, and digestive tract has to cope with the side effects of these medications. And for those of you that have been a type 1 or type 2 diabetic for some time, that are now being sent for lab work every month or 6 weeks or 8 weeks, part of the reason they're doing that is to determine the function of your kidneys, what's called a renal profile, and your liver profile, namely the liver enzyme. So when these meds get processed by these organs, they're very harsh and they can cause some real problems. But that's only part of the problem. The other part of the problem, it leaves you with no responsibility. So your blood sugar goes up because you had this certain type of meal. Well, you'll just take more insulin to get it down, or you'll just take more metformin or glucophage to get it down, as instructed by your PA, your physician. And that really looks good theoretically, but in the application process, all you're doing is driving that problem deeper into your body. And that's not the way that your body was designed to function. So you have to be really careful about how that is applied, and definitely keep your PA and your primary care abreast, but at the same time try not to put yourselves in the position where that increase in medication or the use of it is how you're balancing your blood sugar. Because I can tell you firsthand from watching my father and my uncle and patients I've worked with over 20 years, it's a road to disaster. Because yes, it may keep your numbers low, or your numbers are managed, but they're managed at what expense and for how long? Because eventually what happens is the cell membrane that's designed for the insulin to work with, grab the sugar and bring it into the cell, starts to become resistant. We've all heard of insulin resistance. Because when the pancreas makes the insulin and the other hormone systems make the insulin, they make it on demand instantaneously. And when you make something like that instantaneously, naturally by the human body, the effects are just tremendous, because it can make specifically and accurately exactly what the body needs. So again, there's a whole sequela of negative events: cardiovascular disease, liver disorders, digestive problems, insulin resistance problems. So again, I'm not here to bash anyone or any approach. I'm here to say, what are we trying to accomplish? Are we trying to get a handle on this disorder and remedy it if it's a type 2 or pre-diabetes or a type 1.5? It's certainly possible. The research is crystal clear on that. It's been being done since 1983. Or are we trying just to play with numbers? Because if your goal is just to control your numbers, insulin and the new drugs coming on the market can control the numbers but not improve the health. Neuropathy still happens, feet going numb, hands tingling, vision loss. That still happens because, again, synthetically made insulin products aren't nearly as efficient as the body's own production. So I want you to consider that and really take a step back and think, okay, what are my goals here? If your goals are to resolve the problem, it's certainly within your grasp in most cases. And I've seen severe cases where that's come to pass. And the key is to do simple steps at certain times, and you become empowered. So again, just realize that the medication is not a resolution. If that were the case, we wouldn't have over 30 million type 2 diabetics in this country. So I hope this video gets your mind thinking and in a positive way, and says, what can I do to be more proactive? Is medication the answer? Well, it may be a stopgap now, but what's my long-term approach? What's my 3-month? What's my 6 months? What's my 1 year? What's my 5 year? Because I can tell you that if that's your only approach, things will only get more complicated. And again, I know firsthand from my family and thousands of patients I've worked with. So I'm Dr. George Cosmides. I'm sorry if I get a little bit heartfelt and I seem like I'm very emotional, because it's a very emotional topic for me. And I want to get you, the viewer of this piece of video, to realize that there is something that you can do. Drugs are not the only answer. They're not the answer. They're a stopgap measure that leads you down a more destructive road because you've placed your faith in them resolving or managing your condition. But what about resolving it? And that's the work that I do. I'm Dr. George Cosmides, drcosmides.com, home of healthy aging, founder and developer of the Life Without Diabetes program. And I'll talk to you again soon. Bye-bye. Thank you for watching.